that I wanted to share with you today. So let's just jump right in and get started. And thank you so much for being here today.
You're welcome. It's an honor to be here.
And it's an honor to have you here. And when I say wit and wisdom, I mean that. She has this amazing sense of humor. If you read her book, The DNA of Hope, you get that, her stories, her wit. But she has the most amazing brain that I've ever encountered because she remembers all kinds of amazing facts. She researches and she's dedicated to her patients to helping them to actually get well. She's not one of these people who says, which I just heard somebody's doctor said this to them the other day and I just cringed. Oh, I don't know what's wrong with you. It must be all in your head. This was within minutes of coming in without examination, without labs, without a lot of questioning. Oh, the medication didn't work for you. So therefore, I don't know what's wrong with you. So you're just going to have to live with it. This is not true. And if you've ever heard that said to you, if you're a practitioner who has said that to people, we forgive you because it's all in your training. It's not about your heart and where you want to come from. So we're going to provide some good advice for you today to help you to talk about sleep. So, and tell us, like, why is sleep such a big issue for people?
I think sleep is such a big issue because A, it's complex, but B, we spend more time in wake than in sleep. So
Mm,
I have so many people that have their foot on the gas pedal and their foot on the brake at the same time. And they're just going in circles and circles and circles. And I say they're rocking around the clock. And, and they are, but we cannot do that. And the research in 2022 is so incredibly critical to sleep because sleep is now the tipping point. It's the top of the Everest, the top of the mountain, so that everything comes underneath it. And we have been trying to get physicians and people to notice this. And we talk about chronobiology and really boring terms like that. And people don't get it. Nobody asked you, how are you sleeping? And all the deep
right.
questions. So when you rock around the clock, we ask you to do one thing, and that's schedule your sleep. And it's amazing how many people start doing that, and they come back to me and they say, my sleep is much better. But
Mm,
sleep is so complex that my case studies go much deeper than wearing a mask and scheduling your sleep. We go down to the gut, we go down to the sinuses. We check just everything because I'm an investigative functional medicine practitioner and I like to dig deep. I'm a detective, a health detective. And when you sleep, you put your body in the shop. So I'm also a repair woman. I repair the shop. That's your immunity, that's your detox, that's your happiness. Did you know you get happier if you sleep well? Your
yeah.
immunity gets better, your white blood cells react better. If you're dating somebody, that's extremely important because when you date, your immunity gets better. But if you're sleeping better, your immunity gets even better, and then you get happier. So it's nice to be dating and be happy, for one thing.
Uh-huh.
But
It's
back
nice to be happy whether you're dating or not, right?
That's right, happy whether you're dating or not.
Oh
Um,
my. Yeah.
Contrary to most opinion, we don't sleep by the clock. We actually sleep by the sun. And that's where I come in as a thought leader because the research is so clock oriented. If you read the research, and I've read about 4 feet of it, and it's pretty cool. If you want some good research, go to Google Scholars. I mean, forget about Dr. Google. He doesn't know a whole lot, but Dr. Google Scholar knows a whole lot.
Yeah.
So when you go to the research, what you're going to find is there's clocks here, there's clocks there. But my question is, when Einstein talks about physics and matter, he talks about matter, energy, synergy, and he doesn't talk about time. He talks about time as voluntary. So when we think of time as voluntary, we wear clocks, but my cell doesn't wear clocks. My brain doesn't wear a clock. Nothing. An animal doesn't wear a clock. So we have to think that what is driving sleep, and it's driven by the geophysical properties of physics and the world and the Earth's rotation. So therefore, it's more of a compass than a clock. And when I ask people to follow the sun, They get it immediately. And that's my goal as an educator, to get people to think of it immediately. I don't want to talk about this gene and that gene and what it does and what it doesn't do, and et cetera. I want you to follow the sun. You wake up in the morning when the sun gets up. You go to sleep when the sun goes down. Simple.
Wow. It sounds simple, right? And people
It's
want
that
it to be
simple.
simple. So
That's
I
right.
want to find a couple of things you said that like confused me a little bit based on conversations we've had already. So I've heard you talk about the circadian clock and the clock genes, but you just said it's not really a clock, it's a compass.
Right.
So I'd love to hear that differentiation. Like how, like, is there a circadian clock? What is it? And how do we use it as normal individual human beings that are trying to get a good night's sleep as opposed to researchers. And I will say, just to throw in, on about Anne, she's been in functional medicine and conventional medicine. She's conventionally medicine trained as a nurse and been doing it for what, 40 years or something?
Right.
Doing functional medicine since before it became popular, back in the day when she and I and a handful of others were doing it and nobody called it anything but like we didn't have a name for it even. So she's the ever present researcher, and she's worked with thousands of patients and helped them to actually restore the balance to this circadian compass, clock, rhythm, whatever you want to call it. Talk about circadian and
Okay.
talk about how that has to do with our sleep.
So a circadian means that there's at least a 24-hour rhythm, and it's basically a 24.2-hour rhythm if you really want to get exact. Some of the geeks like to know that, so we let them know. We got to take care of the geeks. So it's a 24-hour rhythm, and that 24-hour rhythm is based on the sun rising in the morning, setting in the sun, going down to the other side of the earth as the moon comes up. And if you'll see, it's a sine and a cosine. Those of you that love trig and love math, that's the same thing, that when the sun goes into your eyes and turns into an electrical signal and goes back into the suprachiasmatic nucleus, which is the back of the brain, two pinpricks. That's all it is. It's got like 50,000 neurons, two pinpricks. That's all it is. It is the master controller of everything to turn you on in the morning. It's incredible. So light goes back there. The suprachiasmatic nucleus has never seen the sun. The brain has never seen the sun, but it turns on all of your genes at appropriate times, or as appropriate to the geophysical compass within you. So it turns on your wake up. And when you wake up, when the sun goes into your eye, then your cortisol goes up and your melatonin goes down. Very, very critical for you. And then an hour after you wake up, you're ready for your first meal. And I hope you eat breakfast. Unfortunately, genes from our parents who don't eat breakfast goes to the children. So you got a whole bunch of people that don't eat the most important meal in the day, and that is breakfast. So when you eat your breakfast an hour after, your liver has swollen a little bit with fluid, getting ready for the protein and the carb load that you're going to feed it. And you need a carb load because you have to feed your sleep at night, and it needs some carbs. Now, I don't mean McDonald carbs, or maybe I shouldn't say that word, but what I mean is some good, healthy vegetable carbs. Those are like so important to you. And then later on, other genes turn on, and you're getting ready for some exercise. You're getting ready for this, for that. And the genes turn on sequentially based on the geophysical properties and how you manage them. So when you get ready for bed, it is most important that you eat 3 hours before you go to bed, because the gut and the intestines turns off and puts a sign out. We're closed, kitchen's closed, oven's off, towels are washed, we are done for the night. And then if you eat, the hormones aren't there, so it goes right into fat. So if you want to get fat, eat before you go to bed. However, if you have a diabetic problem and you need to eat before bed, then we need to work with your diabetes so that that doesn't happen. But eating before bed does produce more adipose tissue. Plus, your gut is not ready, and it can lead to acid reflux and a whole bunch of other things.
So a
So,
couple of things there. A couple of
yeah,
things I want to say. So I found that most diabetics do best when they don't eat before bed. It's just a matter of getting their bodies used to the fact that they're not going to be getting this influx. with diabetes are told to eat, or blood sugar imbalance, insulin resistance, are told to eat every couple of hours, which is the worst thing you can do for diabetes. So yes, some people, we have to work with them so that you can move back that feeding window. But I agree 100%. What I found is a huge difference between eating right before bed and eating there. And there's a ton of studies like that that say give somebody the same amount of calories, the same carbohydrate, protein, fat ratio right in the evening versus earlier in the day, and they'll gain weight on that same exact amount of calories.
Mhm.
Fascinating, isn't it? And it interrupts sleep,
Right.
right? Interrupt sleep, and you're not able to fall into that because you don't get the growth hormone surge that happens right after, within an hour of falling asleep, because insulin's there, and insulin is a bad brother to growth hormone and beats it up and says, go away, I'm in control here. So hormones are just so fascinating, aren't
They
they?
are. They are.
They're fascinating. But the one thing I want to say, because we hear so much, and I'm a big proponent of it, and I don't eat breakfast. I do eat breakfast, break my fast, but I usually do it later. I don't do it within an hour. And I find there's so much intermittent fasting and people getting really good results by allowing for that longer stretch. Like
Mhm.
instead of 12-hour window, finish eating at 6, get up at 6 and eat breakfast. They go longer, and that actually helps their digestion, and that helps their insulin and their ketones and all that. So I'd love to hear, a little bit of say on that, because been I've been eating my first meal usually. Today I ate it earlier because I got up earlier, but usually I eat my first meal between 12 and 2 p.m.
Okay.
and I sleep fine.
Okay.
So I would love to hear a little bit more about that. And the people, I know there's so many YouTube videos out there on fasting and, going those longer periods. So would love to hear more about that.
One thing you need to do is know your body. Know your body and what it takes, because for some people that would be very difficult to not to have the first meal until noon. But for some people, intermittent fasting is excellent because it actually boosts and regenerates your mitochondria, which makes your ATP and your energy. And you need to do that. So I believe in intermittent fasting. I think it is the way to go. For some people, keto cannot work because they actually have a gene that doesn't manage keto, so they get the keto flu and a whole bunch of other things.
Yeah. Yeah.
So that's one thing we work with is genetics also.
So it's
But
individuality is what I hear you saying, just not to
Mhm.
interrupt. I want you to keep going, but it's the biochemical individuality that we have to work with. It's
We
not
definitely have to, right?
always.
Right, because every person is different, and that's why we have functional medicine. It's not one thing. It's not a stamp.
Yeah.
Definitely isn't. So, intermittent fasting also turns on your longevity. It turns on your epigenetics. It does a number of things, and longevity is extremely important to people. So, your mitochondria really don't like food, which is
Right.
kind of fascinating. They need food, but not that much because it increases their oxidative stress or their rust within them, and
Right.
then they get smaller and smaller. And you don't want very small mitochondria. You want them fat and happy and robust. Okay,
Right,
because
right.
they're
It helps
everything.
more energy for you that way. Okay, so you mentioned clock genes, right?
Mhm.
So a Cliff Notes version, because I know I can ask you a question, you can go on for hours about clock genes and what they are, but it gives us an idea. You mentioned, they turn on at certain times, there's other ones that turn off. Tell us just a little like Cliff Notes version of what clock genes are.
Clock genes are the orchestra within you that turns on life. That's the Cliff Notes.
Wow.
And it turns on a web of life within you. So when the orchestra starts with light coming in, light is a power that has changed the world, which created civilization disease, thanks to electricity. So we now have sleep as as a civilization disease. But when that light turns on, it turns on an orchestra of genius. You got the violins in one area and the drums in the other, and it just gets them all collaborating and talking to each other, clocks, circumpasses in every single organ.
Mm,
And your main one that I would like to talk about is the BMAL, also called the ARNTL, and that means brain and muscle. It is the rhythm producer in your body. So If you're really good at dance, if you're really good at rhythm, your BMAL gene is good. We call it the Elvis gene. All right. And the reason is it does turn on the rhythm in the body, and that is so critical to everything about you. The other gene that I like to talk about is the clock gene. And the clock gene, the last K means kaput. So you always wonder why it means kaput. Well, it means kaput because the L means locomotion. If that gene is lower functioning, and just to take time, I'm not going to explain lower functioning, but there's three ways. It could be high functioning, normal, or low. And then your lower function, if it's a clock gene, you have less locomotive ability, probably more falling, more challenges in that, but it is locomotive kaput. It's a fascinating name for a gene. Obviously, some of these things were named after rats and mice, where a lot of the research is, and then we have to live with the names. But there's also the PER gene, which I talk about in depth on my webinar, which is coming up August 31st at 4 p.m. Eastern. And the PER gene is the SAD gene. Behind the SAD gene is protein folding. Behind protein folding is heart disease. Behind heart disease is depression. Behind depression is Alzheimer's. So that's your PER2 gene, and it needs light. It needs sunlight in the morning. If you're not getting sunlight in the morning, those are the things you're exposed to with a low functioning PER gene. And I would say 80% of my clients have a low functioning PER2 gene.
And
We
it's
get
low
light.
functioning because maybe genetically you've got some sort of a variation there, but also because most people are not getting sunlight in the morning. They just get up, they brush their teeth, they take a shower, they get in their car, they drive to work, they go indoors, they're indoors all day. Some don't even go out at lunchtime and grab some sunlight then and go back home. By the time you get home and get to bed, or get in the house, the sun's gone down. So a lot of people are really sunlight deprived. And I would say that's one of the deficiencies I see most. Yeah, we see vitamin D and A and all these other deficiencies, but sunlight deprivation is huge, right?
Huge. And
Yeah.
interesting that B12 is also made in the retinal area of the eye. So we see that on the circadian gene map. B12 is right above melatonin. So yeah, it is. The hormones are interesting. The vitamins are also interesting.
It's all fascinating, the whole biochemistry of the body. I have these really cool charts here that these open up to like 6 feet each. One is the metabolic pathways, one's cellular. And I like geek out on this stuff. I just love to look at these things and, just kind of think about when someone is having specific symptoms and knowing how the biochemistry, the pathways are supposed to work, and
Mhm.
then looking at what's not working and how do we go in there and help to via nutrition,
Right.
sleep, lifestyle, etc., do some things to optimize those pathways. And shockingly, and I know you'll talk more about that on your webinar, you've got some amazing case studies. It's just fascinating. There's so much stuff about sleep that we don't know that we need to know in order to optimize it, because sleep deprivation leads to ADD. Sleep deprivation leads to poor judgment and poor response time. It's so many things that poor sleep deprivation is
Mhm.
bad for. And I know that one of the things you're going to talk about in your webinar is about who's stealing your sleep, like all the different things that are stealing your sleep, right?
Yeah, there's a lot of them. Yeah.
So, what else can you tell? Like, if people are like, "Oh my God, this is too complicated. I'll just gonna take Ambien and go try to get some sleep, or knock myself over the head, or drink some alcohol, or something to knock
Okay.
me out." Like, let's talk about a couple of those things, and then what would you say? Like, one thing that you would want somebody to take away from just listening to this little snippet on
Mhm.
sleep that they could take away and just start incorporating every day that would make a difference in their sleep.
The one snippet that I would say, and I don't follow rules. I'm out of the box, so I'm going to give you three. Okay.
All right, I'll let you.
All right. Schedule your sleep. Okay. And this is for families. Start scheduling your sleep and keep to it. Be consistent. That's two. And for those two things, it's critically important to get light. So schedule your sleep, get up, have some family time in the sun in the morning. We are so focused on getting to work and doing work, but are we focused on our personal wellness so that we can be around to give more and to give more to others? That's what my parents taught me, and that's what I want to do, and I think it's critically important that we follow that. Scheduling sleep is really important.
Yeah, I think
As
it's great.
alcohol keeps you awake, it helps you sleep, but not in your deep rhythm, and, alcohol does so many other things to you, liver-wise, etcetera, so we ask you to try to stay away from that and cut down. And you mentioned one other the, medications. The medications, there are so many of them, but, why would you want medications if you could naturally control your sleep and wake up without the side effects of a medicine? And I understand on TV, I don't have a television, but, they explain all these side effects, and why would you want those?
Which one does? Right. I was listening to I listen to a lot of audiobooks when I exercise, and I've listened to a couple of sleep books recently, and when it was talking about like really when you do these medications, they may knock you out, but the quality of your sleep is affected, the amount of deep sleep is affected, and then there's that narcotic kind of effect, that
Right.
hangover effect in the morning that you get from it, and then you don't have that energetic next day. And the whole point of sleeping is to regenerate and recuperate and have really a lot to give the next day. So I
Mm,
see that those aren't, the best approaches.
yeah.
So some of this stuff is going to take some dedication, right? You have to do the work if you want to have the
Mhm.
health, right? And it'll be true health as opposed to, out of the bottle and trying to get it together, right?
And one tip that a neurologist told me, he said, when you wake up in the morning, you turn around and do as many squats or planks as you can. You drop your melatonin then, and your cortisol rises, and then you are ready for the day. It's a wake up charge, and I give that charge to you. So wake up in the morning, do your planks immediately or your squats. And when I give this to people, I've got a skinny lady come back and say, I did my 30 planks. I didn't think she could do one. And it's incredible. So when you're motivated and you do these things and you're in high performance, your life changes, and that's what we do. High performance.
Love that. I have started to do like a push up. Is push up count as planks, or should I just do planks too? I'll add the planks, but push ups. So I'm doing 50 push ups a day and 50 squats a day, not all consecutive, but I started like I do 20 of them usually first thing in the morning. Like I just get out of bed and do those, and then I'll do some later in the day. So that gets things going. It's good to know that it brings up the cortisol. And yeah, I always feel like energized. So I have to make sure I don't do them right before bed because
Right.
then I get energized
Not a
right
good thing.
before bed, right? So
Right.
get them all done. I've already done 40 of each today. So I have 10 more to do, and I'll do it long before bed. Awesome stuff. Awesome stuff. So tell us about what you're planning to go in deeper with this stuff in the webinar. Like here, we're not having slides, we're just having a conversation, but you have some really good information to share and really good strategies. So tell us a little bit about that.
So the webinar is August 31st. And if you send your email in, or if there's a button, whatever, for us to press for, if you are interested in the webinar is going to be about 45 minutes to an hour long. And I start explaining what is, now that's not my dog this time. What is sleep? And a lot of people don't really know what it is, but it'll shock you when I tell you some of this. And then I ask you what your sleep thieves are, or who's stealing it from you, because it's either who or what is stealing your sleep, and you can't let it. It is the most important prize you've got, other than your soul. Those two things, hang on to them. And then we go into some case studies, and I actually show you like why so many of my clients come with a gut problem when they don't even know they have a sleep problem. And that's because the amplitude of your waves in your gut flips when you are uh, unsynchronized in your sleep. So instead of being a nice sine and cosine, remember that, it actually goes like this, upside down. Okay.
Mm.
This is not good. The muscles for sarcopenia go flat with poor sleep. Flat meaning that you end up with poor mitochondria and fat in your muscles, and that is called sarcopenia. So your volume and your amplitude of your genes change as you sleep, and it's critically important to get the correct amount of sleep so that you are making high amplitude waves, so your body hears it when it says sleep, and it
Mm.
doesn't say, and then you wake up counting sheep that end up on the floor being counted so many times, they are there down there, and you're still wake up at 3 a.m. in the morning, and this is not good.
Not good
So
at all, not good at all. Yeah,
I
so
can
if you're listening here now, we don't have a link yet because it's still in the process of being set up, but it will be. If you're listening to this after the fact, you'll probably check in the comments, but put your in the comments field if you're interested, put it in there. It's just say I'm interested in the webinar, and we'll make sure that the link gets posted, or if you want us to email it to you, just, do that as well. Yeah, because I think it's going to be pretty amazing. I'm inviting all my followers to it, and my email list and my practitioner list and everybody, because so many people are having this problem, and Anne has some very unique approaches to it that aren't really talked about mainstream. No, she's not going to tell you to get some valerian, and she's not going to tell you, about passion flower, which are all good things, but they're not really solving the deep underlying problem. She's going to talk about things that actually are going to solve this problem and identify, and it's going to be a little different for each person, but she's going to talk about how she can help you identify the underlying causes of your sleep problem. Like I've been mentioning to her, my husband, who has wonderful sleep, he falls asleep in like that. But he wakes up early in the morning, and when he checks on his Aura ring, he gets very little deep sleep, right? So we need to look at how do we help him get more deep sleep. And yes, he's been listening to the get to bed earlier. He's been going to
good.
bed at 30, and he's been doing the no food right, within 3 hours of bed pretty regularly. And sometimes it goes higher and sometimes not. And he does the dark, so he does a lot of this stuff. So I'm going to have him listen to you explain this to see if we can find some things he's not doing,
Mhm.
right? That we can get him to do to get the deep sleep up. He gets a lot of sleep, but he doesn't get enough of the deep restorative sleep, right? And that's where the melatonin is like, peeking out and helping you to just stay deep and restore and replenish and get all your body systems back to working again. So,
And then from that webinar, I opened up my 6-week program, which is Tuesday, Wednesday, and Thursday, starting in September, early September. And that 6 weeks is both food and sleep, and how to restore your sleep. So there's so much to sleep. There's no way I could do it in one webinar. No way.
no, well, nothing, right? That's why we do a lot of videos, we do a lot of stuff, and there's no way people can get it all. Even if you could, like, talk really fast and cram it all in,
Right.
our brains are such that we learn incrementally. You learn about this, and then you add on this, and then you add on that. So that's why we invited Anne here a couple of weeks before her webinar. I'll be there with her on the webinar, and I look forward to it because I've been watching it in action as she's been creating this. Anne's one of our nutritional endocrinology practitioners, and I work very closely with her as part of our practice accelerator to help her to get all of this brilliance that's in here out there so all of you can benefit from it, right? So I thank you so much. Are there any parting words you'd like to leave people with today?
Sure. We are the future. And as the future, we need to change our sleep in order to be the best possible person that we could be. So schedule your sleep and be the best.
Yay. Thank you. We've been talking to Ann Johnson. I'm Dr. Rita Marie. Welcome back to the channel. If you haven't already subscribed, go subscribe down below. Please put your comments down below and let us know what you think about this, what questions you may have. And if questions pop up, we'll send Ann back over here to answer them for you. If some of them are going to be answered at the webinar, soon as we have that link, we'll put it in the chat, in the comments below. And I look forward to seeing you in 2 weeks with Anne to go deep on your sleep because you deserve it. We all need to sleep deeply and to be our best selves. So thank
Right.
you, Anne. Thank you, everybody, for listening, and we'll see you on the next one.